probably realize that these do not reflect the actual true burden of COVID-19 over the course of the pandemic. We count most COVID deaths, but contrary to popular belief, we're not overcounting COVID deaths, we are undercounting COVID deaths. And we also don't count many of the other deaths that are probably indirectly related to COVID, particularly when you look at deaths that occur in the healthcare system that are the result of inadequate care or missed opportunities for interventions that occur when hospitals and health systems are overwhelmed. And I think you can see the effect of this when you look at excess mortality data from the US. And so as I think you all probably know, US public health has pretty good records over the years of number of deaths that can be expected in the population given age and demographics and other changes that occur. And so we're pretty good at calculating what we should expect in terms of deaths over the course of a year and cumulatively for a year. And then calculating excess mortality. So understanding when deaths are exceeding what we would expect. And as you can see over the course of the pandemic, we have consistently outpaced the number of confirmed COVID deaths with excess deaths compared to expected. And those curves line up pretty well and show us that over the last 2 years, it's not 1 million COVID deaths we've experienced, but actually over 1.2 million excess deaths that include those COVID deaths, but also include uncounted COVID deaths, and again, deaths from other conditions that were exacerbated or precipitated by the fact that health systems were overwhelmed managing COVID. And so we should really count the true pandemic toll as over 1.2 million deaths, or about 20% more than the official COVID death count is. Now, a lot of people have tried to explain that, well, these deaths are due to all of the lockdowns we've experienced and various ramifications because of that, including things like suicide, which does not actually pan out when you look at the data. It takes a long time for us to accumulate suicide mortality statistics. But if you did not see a couple of weeks ago, the CDC released those stats for 2020 and revealing that suicide mortality was actually lower in 2020 compared to expected rates. And so that's not the reason why we had so many more deaths. And if you look at the curves of excess mortality and COVID deaths, they line up pretty darn exactly. So you can see that each wave on the bottom curve, that is the COVID deaths associated with those epidemic waves of spring of 20, summer of 20, winter of 20 and 21, then Delta and now Omicron. You can see that those curves line up pretty much perfectly with excess mortality. When COVID deaths are high, excess mortality is high. When COVID deaths are low, excess mortality is low. And again, this also represents burden on the health system because those death curves line up with hospital demand curve for COVID care. And so those periods of excess mortality, high excess mortality, are periods when the health system is overwhelmed and when we're experiencing a lot of COVID deaths. And there you can see these last two epidemic waves, Delta and Omicron, don't really have a significant drop in excess mortality compared to our previous experience. So even though we're supposedly seeing more mild coronaviruses, that does not bear out in data again. And obviously the cumulative number of excess deaths is the area under that curve between those two Delta and Omicron waves. And you can see that area under the curve is greater than at any other similar time period during the course of the pandemic. So we're actually continuing to experience more COVID mortality and more excess mortality over this past year. Obviously, we're down at thankfully a low rate now, but we'll see how that lasts. Also, contrary to popular belief, it is not only the elderly that are experiencing excess mortality. As you can see, for the first 3 waves of the pandemic in the US, people over the age of 65 did have the highest rate of excess mortality. You can see exceeding 40% excess mortality during the original spring wave and the fall and winter 2020-2021 waves. However, excess mortality in people over the age of 65 actually was lower during the Delta and Omicron waves compared to the previous maximum, whereas in people between the ages of 15 and 64, they experienced their highest rates of excess mortality during the Delta wave. And you can see over 60% increase in excess mortality, which is far above what any other age group experienced. Now, it's true that people between the ages of 15 and 64 die at a much lower rate at baseline. So the absolute number of excess deaths was lower than what you would get for comparable age brackets in people over the age of 65. Nevertheless, in general, in the US, a lot of, not many people between the ages of 15 and 64 die in a given year. And so COVID produced a very significant increase in excess mortality in that group. You can also see that in kids under the age of 15, we also saw the highest rates of excess mortality during that Delta wave in the fall and into the early winter of this past year. And we saw a significant spike in excess mortality from the Omicron wave too. And so those age groups under the age of 65, where we have much lower vaccination rates, have seen some of their highest rates of excess mortality here within the last 9 months or so. Now, if you look at other countries, I think this highlights some of those things that I talked about. And so we'll look at Japan first as an example. So Japan has experienced over the last year and a half an increase in COVID-19 mortality based on higher transmissibility of virus and larger outbreaks. As you can see, very early on for the first year of the pandemic, or 9 months of the pandemic, they had very, very low mortality and actually negative excess mortality. So you can see that they lost fewer lives over the course of 2020 and into 2021 than would be expected at baseline. And so you can see those little accelerations in COVID deaths during the winter 2021 wave, the Alpha wave, and the Delta wave. And it was only really after the winter 2021 wave that excess mortality started to catch up and exceeded the expected over the last several months. And when they had an acceleration with the Omicron wave recently, that's when they had a significant jump in excess mortality. And that corresponded with the highest burdens that Japan has seen in their health system to date. Now, if you look at a curve over time, looking at excess mortality rates by month, you can see that similar to the US, these correlate with when they had their significant epidemic waves, but just at a much lower rate of excess mortality compared to the US, because Japan has done so much of a better job early on of implementing non-pharmaceutical interventions, and then recently achieving high rates of vaccination and particularly boosting. And so it's important, I think, then to look at that excess mortality rate and compare it to phases of the pandemic response. When Japan had very intense non-pharmaceutical interventions for about the first year or so of the pandemic before they really started relaxing provisions, you can see that they had negative excess mortality. So they had fewer deaths during that period of time than one would expect in Japan. So I think this hopefully effectively pushes back against that argument that, lockdowns and non-pharmaceutical interventions are actually leading to excess mortality. In countries like Japan, where they implemented not lockdowns in the sense of what we would consider, keeping people at home and shutting down most businesses. Japan was actually much more reasonable and targeted in the interventions they took, and as a result had amazingly good success in controlling cases. But as you can see, the increased period of COVID deaths corresponded with their increased excess mortality, showing again that excess mortality really just mirrors COVID disease burden and COVID mortality in your population. It does not reflect intensity of non-pharmaceutical interventions. And as I mentioned, Japan has done much, much better than the US in terms of controlling COVID, and particularly controlling COVID mortality. So you can see that over the first 9 months of the pandemic, they experienced very, very few deaths. They had some increase in deaths again over the last year, corresponding with several waves, and the highest increase they had was in Omicron, but still that leaves them at an overall COVID mortality rate of about 240 per million population over the course of the pandemic. That's in contrast to our rate, which has been over 3,000. So therefore, Japan has had about a 12.5-fold lower COVID mortality rate over the course of the pandemic as compared to the US. And if we had that same rate of COVID mortality, we wouldn't have 1 million COVID deaths in the US, we would only have 80,000. So this shows you how much more effective certain countries have been in managing the COVID pandemic, and what could have been if the US had been able to implement the same type of strategy that Japan had. Now, this isn't just true of Japan, it's true of other countries that managed the epidemic well. And again, South Korea, another example. If you look early on during the course of the pandemic, they actually had, again, negative excess mortality, even though they had stricter non-pharmaceutical interventions, or, if you want to use the word lockdowns, which is really inaccurate because neither of these countries really used lockdowns, you can do that. But again, showing excess mortality really mirrors confirmed COVID deaths in terms of when we see increases and when we see low rates. Australia, the same story. Now, Australia is a country that, if you want to use the lockdown term, probably was most reflective of what most people would consider lockdowns. They had much more restrictive limitations on movement and businesses, especially early on. But you can see this did not result in increased mortality. It resulted in decreased mortality. And this is easily explainable when you think about the fact that fewer people driving on the roads, fewer people doing things that would lead to accidental deaths, et cetera. Makes sense that you would have lower mortality rates. But again, when COVID deaths start to kick up, you can see excess mortality increases and finally crosses the 0 line and goes into the positive range. But that's just recently. But again, like South Korea, like Japan, like many other countries that had very effective COVID control, they experienced overall much lower mortality rates from COVID than did the US. And so if you look at these countries that I think many would consider exemplars of managing the pandemic well and limiting hospitalization and mortality, again, that's Japan, South Korea, Australia, also New Zealand, Taiwan, Singapore, Iceland, Finland, Norway. You can see that there's one tremendous outlier here in the United States in terms of our overall COVID deaths per million over the course of the pandemic. Even our neighbor to the north, Canada, which obviously shares culturally and demographically a lot more with us than many of these other countries, has a COVID mortality rate that is 1/3 of what the US does. So again, if the US had only been able to replicate Canada's response, we would have had 300,000 dead Americans rather than 1 million. But this, I think, is hopefully a good pushback on folks who say, well, there's nothing we could have done. This virus is, it is what it is. It's so transmissible, you can't control it and you can't control the impact. That's simply not true. There's many countries that did a much, much better job than we did. And some of these countries obviously had less of a head start than we did, especially the Asian countries, which had early importation of COVID from China and who had access to vaccine much later than we did. If you look at South Korea and Japan and Australia and most of these other countries, for instance, they had much later access to large quantities of vaccines. So they were able to do a lot of this even before vaccine became available. And then when vaccine did become available, they rapidly vaccinated the majority of their population and have maintained that pace of vaccination by keeping up with boosters. And so that's the last thing I'll point out, is that there's another outlier in this graph, which shows the rate of third doses of vaccine. It doesn't reflect fourth dose data, but the fourth dose data are even more of a stark contrast, to be awesome. And I also threw in most of the large European countries here just to show that everyone is boosting their populations at a rate much higher than the US. You can see down where that arrow is, that is our curve, the US, and we are roughly half of what the average is for the rest of developed economies. And that is going to portend very poorly for our experience through the summer and especially into the fall. And so this is where we are now with this forgotten pandemic. Our case counts are approaching what we had seen, in daily cases during the Delta wave back in the fall of 2021, but we're counting, as you can see, at a much lower rate than we were back then. We have been testing much less frequently across the board compared to what we were doing back in the fall. And we also are relying much more on home antigen tests, which don't get reported. So the true number of cases is probably much higher than around the 100,000 a day that we are currently reporting. I would estimate the true rate is probably 5 times that. And so we are probably experiencing case counts at least similar to what we did back in Delta and in the fall 20 and 2021 wave. We've seen a corresponding increase in hospitalizations here over the last several weeks. As you can see, our death rate has not started to reflect that increase yet, but I expect it will. As you remember, deaths usually lag hospitalizations by about 3 to 4 weeks in terms of official counts. And that's what happened in the UK with their latest BA2 wave. And so I think we'll probably follow suit, and we will continue to accumulate more deaths over the course of the summer. But I think the real hit is going to come to us still in the fall when I assume we will still have not remembered that there's a pandemic going on, and boosting rates will continue to be dramatically low. And the time that has lapsed since most Americans received their last dose of vaccine will have been longer and longer. At that point, fewer than 15% of Americans will have received a dose. I think fewer than 10% will have received a dose of vaccine within the past 6 months. And therefore, our population will as a whole be more vulnerable immunologically than we were going into fall of 2021. And that will result in a large surge in hospitalizations and deaths associated with the almost inevitable pandemic wave that will come. So that's where we are at this mark of 1 million deaths. Sadly, I don't think most Americans are even noticing at this point, but whatever we can do to wake folks up and maintain awareness that the pandemic isn't over, even if we think it is, and we will pay for our complacency in the fall if we don't turn things around. That's all I have. Thanks, Dossie.